today let us discuss regarding infant radiant warmer. Okay. We know that after the baby develops, the temperature management problems will be there. So we have to manage the baby temperature by using of the warmer. So this is the instrument name is, the device name is infant radiant warmer. So it's an electronic device. So all the electronic device we need light source, and here we having two buttons is there. One is power button. When you on the power, you'll be having in this panel will be all the device. We can see settings here. So this is our skin temperature. So we having like here skin sensor. This is known as skin sensor. So based on the baby skin temperature, this device you have to place in the right hypochondriac region of the baby and keep the small cluster here, and it maintains its position. And based on the baby skin temperature, the rate of the temperature rate will be displayed here. Now according to here we can see the 25.7 degrees centigrade we can see here. And also we having like three modes is there. What is the three modes? One is warm up. When you start the machine you have to use the warm up mode. And here we having locking system. So this locking system, when you press the locking system and apply mode, the modes will be changing. Second mode is servo mode. Servo mode is the automatic mode. In servo mode we can see this based on the sensor, the temperature will be managed and the warmer temperature will be managed by the servo mode. And manual mode, like if you go to the third one is manual mode. So you can use this arrow keys up and down. When you are up and you have to lock it. So here we can able to use the temperature. So you can see this. Always we having two keys is there. One is mode. Mode means which mode we want. When we want warm up mode or servo mode or manual mode. After locking, which mode you are desired, that you have to set that mode and then lock the settings. After that you have to go for option is setting. Set means how much you want. Based on that, increasing this button can be increase the temperature, and this mode known as heater output. How much heat can be generated by the machine. So it's showing like above 37 degrees centigrade. And also we having like here Apgar score system. So what is this Apgar timer? Minute per second. So usually we can able to reset, start and reset. You can see the baby Apgar score here, and here also we can say here other panel we having over temperature than the baby skin temperature. The machine is giving more temperature. Minimum plus or minus 1 degree centigrade should be managed, but sometimes it is more is there, the alarm will be given here. You have to give attention towards the baby. And also sensor problem with the sensor probe, it's not working, so also it will be displayed here. And temperature error, sometimes temperature is not showing properly, temperature error will be there. Power failure, power circuit, it's an electronic device, power is not coming to the machine, the light will come here. And system fail, any functional errors will be there, so this will be indicating. And when you want to stop these alarms, you have to stop here. And here also, then what is this here? We having one light source is there. This is known as high illumination. High means more power will be there. You can see, you can examine the baby properly by using this light. So whenever you require this light can be used. Again here we having one adapter type small mobile locking system here. According to baby direction, baby is another direction. For example, you are giving feeding, you make the baby in the other direction will be different. So you can check it and you have to lock it. Once you did this position should be always in the upper direction. Okay. And most of the time this procedure, sometimes the baby you have to check for hydration. So here also you can give the IV fluids, other normal, all the procedure. If the baby in NICU, we need IV fluid therapy, oxygen therapy, feeding, everything you can do it. So you have to, in this warmer, baby temperature will be managed, and you try to do the any procedure. And apart that, for feeding, what position you use? High fallus. So here you can adjust the shape of the device, or you can adjust the position of the baby by using of this. For example, high follows position mostly mandatory for feeding. So you have to adjust the position, or even suctioning time, or the other procedure. It's maintain comfortable area for the baby for management of the hypothermia. So that's why we say it's a infant walk.